Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. She is joined by the Minister of Health, Tyler Shandro. Dr. Hinshaw will provide a brief update, and then we will turn the floor over to the Minister.
Thank you, Tom, and good afternoon, everyone. Before providing today's update, I want to address reporting related to conversations of discussions at internal Emergency Operations Centre meetings. I am profoundly disappointed that confidential internal conversations have been shared, actions that are a violation of the Public Service Oath and Code of Conduct. This is a personal betrayal and a betrayal of the trust that our hardworking team has placed in each other. For months, I have worked alongside a team that has been dedicated to supporting Albertans in responding to COVID-19. The team has been committed to providing evidence to inform policy decisions. They have spent time away from their families to do this work and provide their best advice. They have given their all, and they continue to do so. I am profoundly grateful for the commitment of this team, and today I have reminded them of my gratitude and commitment to their work. Almost every day of the week, we discuss how to improve the pandemic response and to debate a variety of ideas about how we can do better. The comments, as reported, are taken out of context, separated from the many other discussions that would have occurred in the days before and after, as part of ongoing discussions to ensure that my advice to the Premier and to the Minister of Health is grounded in evidence and considers every facet of potential discussions with elected leaders. This process has been violated. These meetings should be a safe space where public servants have candid and ongoing conversations and debates. This safety and trust are now broken. I have been clear that my role as Chief Medical Officer of Health is set out in legislation. My role is to provide the best advice possible to elected officials on how to protect the public health of all Albertans. I take that responsibility seriously. I care deeply about the health of Albertans. It remains my hope that Albertans understand that and respect that every conversation I have puts their health and a holistic consideration of all aspects of their health first. There are no risk-free options with COVID-19. This pandemic has challenged us all and required a wide range of complex decisions, all of which have strengths and weaknesses. I continually provide recommendations to government, often outlining a range of policy alternatives which they then debate. Once elected officials make a decision, my team works to implement the policy direction that the government has chosen, working with public health officials, Alberta Health Services, and the rest of the public service to do everything possible to limit the spread of COVID-19. I have always felt that my ideas are respectfully considered. I have always had respectful discussions between public servants and with elected officials. I do not dictate every detail of each policy decision, and I should not. I was not elected by Albertans. The final decisions are up to elected officials who were chosen by Albertans. This is how democracy works. I know that there are many views about how we should proceed. However, we are becoming divided when we most need to engage in respectful dialogue. We need to do this together for the health of all Albertans. We must listen to and consider the thoughts of others who do not agree with us. All of us want the same thing: to protect the health of Albertans, to protect our health system, and to minimize the impact this pandemic is having on everyone's lives. I have often said we are all in this together because I believe it, and it remains as true today as ever. Turning to today's numbers, over the last 24 hours, we have identified 1,077 new cases of COVID-19 in Alberta, and about 15,900 tests were completed yesterday. This means that our provincial positivity rate currently sits at about 7%, and we have 14,052 active cases. There are 383 people in hospital. Of those, 84 are in ICU. Sadly, I must also report 10 new deaths that were reported to us over the past 24 hours. My condolences go out to the loved ones and friends who are mourning these lives lost. Turning to schools, there are currently active alerts or outbreaks in 359 schools, about 15% of all schools in Alberta. Currently, these schools have a combined total of 1,288 active cases. This number includes 190 schools with outbreaks, including 84 currently on the watch list. We continue to review the emerging evidence around COVID-19 and the best way to protect Albertans. We have posted new fact sheets online today, summarizing some of the recent literature on ways that COVID-19 is transmitted, masks, and aerosol transmission, and what this means for you. There has been interest in aerosol transmission, so let me take a moment to talk about that. The emerging evidence shows what we have said for some time. The dominant mode of transmission is via respiratory droplets that happen when people are in close, unprotected contact within 2 meters. Since early in the pandemic, we've known that aerosol-generating medical procedures have the potential to cause transmission of the virus through the air at longer distances. These procedures occur almost exclusively in medical settings and can be managed through additional infection prevention and control measures. Alberta Health has also been monitoring evidence and outbreaks since the onset of the COVID-19 pandemic. Evidence currently shows that in specific circumstances, there can be increased risk of the virus traveling through the air across greater distances. This is usually seen when individuals are together for prolonged periods of time, especially when doing activities like exercise that makes them expel small particles at greater volumes and distances. I want to be clear that the current evidence indicates COVID does not spread through the same kind of long distances and long times that measles does. And the core recommendations that have been in place since the spring remain true. Stay home when sick, wash or sanitize your hands regularly, keep distanced, and wear masks indoors when around those outside your household. Personal protective equipment guidance remains the same, and the current evidence does not indicate a need to change that. There are, however, steps that businesses and others can take, such as paying attention to ventilation of indoor spaces, and we have posted an evidence-based one-pager on our website to help. I want to thank everyone who is making a special effort to comply with the new mandatory and expanded public health measures. I know it creates limitations that can be difficult for individuals and families, for workers and workplaces. No one wants to stand in line to buy groceries. Skype, Zoom, and other media are great, but we all know they don't really replace being together in person. We've gone from being a society of huggers, handshakers, and backpatters to a society of distancers. I know it is hard to keep young children and their grandparents apart and have young teens confined to home instead of sending them off to school. It is difficult and can be lonely to have fewer options to socialize, shop, or be entertained. However, I thank everyone who is making that sacrifice to bring down the threat for everyone. I remind us all that public health measures only work if all of us follow them. I also remind us all that there are clear benefits to socializing outdoors whenever possible. Our province has so many wonderful ways to enjoy winter and the company of family outdoors, properly distanced, of course, and keeping participants to no more than 10. Taking the dog to the off-leash area, using our hiking and biking trails, and enjoying a bonfire in a public park are great ways to rejuvenate the spirit. Hosting a fire in your backyard is not recommended because under the ban on indoor gatherings, your guests cannot go into your house to use the washroom, get snacks, or warm up. And while we can't socialize in our homes, families in the same household can go to a restaurant for a change of scene and cuisine. If you prefer to dine at home, keep it safe. Limit it to only people in the household. We all have options, even under the new public health measures. We all share the same challenges, and we are all in this together. In fact, we are looking to all the public health measures to give us a reset on our case numbers. For that to happen, all of us need to do our part. We need everyone to follow every measure. Just as we all need to work together to be successful, the restrictions in place are only successful if they all work together. Let's bring the numbers down in time for restrictions to ease for the holidays. Let's do everything possible to limit our contacts outside our households. Let's make a special effort to stay in touch with people who are feeling alone or abandoned by calling them, writing them, sending text messages, and visiting outdoors. The more we do that, and the more that each of us goes the extra mile, the more effective we will be in reducing the spread in the coming weeks. I would also like to recognize the nearly 1.3 million Albertans who have now gotten their immunization for influenza this year. This is more than 228,000 more people than at the same time last year. What's more, we have still not seen a single lab-confirmed case of seasonal influenza. We know that influenza hits at different times of the year, depending on the season. So it's not scientifically useful to compare numbers until the very end of the year. But at this time last year, we had already had 464 cases. This does not mean that influenza is no longer a threat, but it is a reminder that there is hope and that our actions can help protect each other from a wide range of illnesses. Unfortunately, COVID-19 is more contagious than influenza, and for some people, far more deadly. There is also no vaccine readily available at this time. This is why we all need to take extra precautions to protect one another. We are in this together, and we will get through this together. Thank you, and I'll now turn the microphone over to the Minister.
Thank you, Dr. Hinshaw. Now, before we begin, I would also like to address the media reports that appeared this morning, quoting recorded meetings within the Ministry of Health and questioning the role of Dr. Hinshaw. Since the pandemic began as Minister of Health, I have worked closely with Dr. Hinshaw. She has provided detailed, evidence-based recommendations to me and to Alberta's government as legislated in the Public Health Act. She has also participated in ongoing cabinet discussions about what is right for Alberta in the response to this pandemic. We listen closely. We debate the range of policy options that she offers and their different impacts. And then as elected officials, we do what we were elected to do. We make decisions that are in the best interests of Albertans. I want to express my own and Alberta's government Alberta's government's support for Dr. Hinshaw. She's one of the finest medical officers of health in the country and has worked tirelessly for months to protect Albertans. The story this morning concerned me for one reason only, that it violated Dr. Hinshaw's confidence and it embarrassed her. I called Dr. Hinshaw this morning to tell her that she has nothing to apologize for and that she has my complete confidence. As we outlined earlier this week, this is a critical juncture for COVID here in Alberta. This is why on Tuesday we announced new measures to reduce the spread of COVID throughout our communities. Due to the virus's 14-day incubation period, it will take a week or two for us to see the results of the new measures. This means that in the short term, we may see cases and hospitalizations continue to rise before we see improvement. We're asking every Albertan to follow these rules and to limit the spread of COVID in their communities. To help make sure people are aware, we will be sending out an emergency alert to all Albertans at 4:20 p.m. today. Now, this will ensure people know that a state of public health emergency has been declared and that mandatory measures are now in effect. Since the beginning of this pandemic, our province has been a leader in testing for COVID-19. Alberta Health Services and Alberta Precision Labs have completed more than 2 million tests for more than 1.3 million people here in Alberta. I'd like to recognize the hard work of those who have made it happen and the Albertans who have shown commitment to protecting one another and their loved ones and our healthcare workers from COVID-19 by getting tested. Today, I'm pleased to announce that Alberta will be introducing point-of-care rapid testing in early December. As we work to address rising cases, we're proud to provide Albertans with faster, more convenient testing for the disease. We'll be rolling out the new Abbott ID Now, as well as the Abbott PanBio COVID-19 testing kits, which have both been approved by Health Canada. We've received more than 577,000 of these tests. Now, they require swabs to be taken by a health professional, so to be clear, they're not rapid home test kits. Rapid tests are only valid for symptomatic folks who have shown symptoms in the last 7 days. So these tests are not for close contacts, nor are they for those who may have been exposed but are asymptomatic. We're being careful. We're recognizing that patient health and safety is the most important. So to start, these tests will be used in clinical pilots at several sites throughout the province, including at assessment centres in Calgary, Edmonton, Slave Lake, and St. Paul. They'll also be piloted at the hospital lab in Bonnyville. More than 100,000 tests are available for distribution to these sites. They'll be used on patients who are within the first 7 days of expressing symptoms. This will allow us to quickly identify and notify positive cases within hours, reducing the need for patient samples to be transported to centralized public laboratories for processing. As these measures will be clinical pilots, 2 swabs will be collected from each patient. All negative tests from the PanBio system that will be introduced in Calgary and Edmonton will be subject to confirmation by the existing lab-based testing process. This is because we're continuing to evaluate the accuracy of both systems, and we don't want to miss any COVID positive samples. These pilots will show us how to seamlessly integrate rapid testing into our existing testing system before starting to use them widely across the province. AHS and APL are also working on expanding the use of point-of-care testing in our continuing care facilities. They're another tool to help protect vulnerable residents across the province. AHS is finalizing logistics now and will provide more information on specific locations in the near future. This is an exciting announcement, and I'm very proud that rapid testing will soon be a reality in our province. Thank you very much, and now happy to take any questions that you might have for us.
Operator, could you put through the first caller, please?
Yes, the first question is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Kevin.
Hi there. This is a question for Dr. Hinshaw. This is a yes or no question. Did you suggest to Cabinet and the Premier a full month lockdown prior to announcing a more limited restriction framework on Tuesday?
Thank you, Kevin. I appreciate that you framed it as a simple question, and yet there are no simple questions in COVID-19. The fact is that the range of options provided were, as I've said, considered, discussed respectfully, and the decisions that were made, as you know, were announced on Tuesday. Every decision that is made, again, has taken into account my recommendations and the recommendations of my team. And I have always appreciated that they are listened to in that course of that discussion.
Minister would like to supplement?
Thank you, Dr. Hinshaw. Kevin, just to be a little bit more clear, I mean, the difficulty with the premise of the question is that it supposes that there is a recommendation that comes to us as Cabinet that's either a yes or no question, and that's not the case. What we end up being proposed is, here's the problem. in the response to the pandemic, and here are a range of options. And so obviously when there's a range of options, we pick one of them. We can't say yes or no. So that's the problem with the question that you're proposing, is that it's assuming that there is one recommendation that comes to us and we say yes or no.
Operator, could you put through the next caller, please?
Next is Carly Robinson with City News. Go ahead, Carly.
Hi, I have a bit of a two-part question. So for Minister Shandro, we'll start with what exactly is happening with enforcement? Our case numbers have risen drastically in recent weeks and months. Will we be seeing more enforcement? And what directives are you giving to AHS around enforcement and needing to go through your office?
Well, nothing goes through our office.
That's my only question.
No, nothing goes through our office. That's a totally insane question. Look, there is going to be more enforcement. That are conversations that we've had with AHS. AHS has been enforcing. Obviously, AHS. When we want to change behavior, whether it's policing or whether it's public health, the best way to get people to change their behavior is through education. It's through prevention. It's through intervention. That's the best way to get people to change their behavior. Enforcement is going to be one of the last tools that are used to get people to change their behavior. They have been enforcing throughout the pandemic. I understand AHS would like to step up enforcement as a means for getting people to follow these public health guidelines. But you said something about things going through our office. That seemed to be one of the suggestions that was included in the media reports today. That is totally wrong and completely insane.
Operator, could you put through the next caller, please?
Next is Don Braid with the Calgary Herald.
Hey, Don.
Go ahead, Don.
Dr. Hinshaw, a two-part question, if I may. How many people actually report to you? And of Tuesday's recommendations, I assume that within the range of the recommendations, one of them was the measures you adopted for restaurants. And if you could confirm that, if that was in the range you suggested. And also, that one seems to be going off the rails because there's a lot of restaurateurs are having real trouble with the idea of questioning people about family cohorts and so forth, and actually it's already cut into business. So thanks for your responses.
Thanks, Don. The question about how many people report to me, I have a small team that directly report to me. So there's about 6 people who directly report to me. However, I work very closely with the Emergency Operations Center and the teams that report to the Incident Commander, and there's approximately 40 people currently in that Emergency Operations Center. And so while they don't report directly to me, I do consider them to be part of my team and really rely on their work. With respect to the restaurant recommendation, again, I would say that the restaurant recommendation as well as the recommendations on other measures were ones that were discussed at length. There's no single option that's going to end the pandemic right away. And so again, all of these measures need to be considered, and we do try in the recommendations we put forward to consider the impact on COVID-19, as well as the impact that the measures have on other aspects of Albertans' health. So that, again, was part of that, both with that measure and the other measures that we put forward.
I believe the Minister has a supplement.
Thanks, Don. And just to be clear, I mean, these are measures that are being imposed on Albertans. So when it comes to restaurants and the requirement for Albertans to if they are going to be attending a restaurant for in-person dining, that they limit it to a single household. Look, this is our measure being imposed on Albertans for them to take that responsibility, for them to be responsible for attending that restaurant for in-person dining as a single household. Of course, our restaurateurs can't, they don't have ESP, and for them to be checking the driver's license of everybody to make sure that they and the children they're attending with are all from the same address. We're not asking for that. We're asking for Albertans to take the responsibility for when they do in-person dining, for them to be going as a single household.
Operator, could you put through the next question, please?
Next is Jesse Weisner with Global TV. Go ahead, Jesse.
Hi, this question is for Dr. Hinshaw. We've learned of a situation where a woman returned to Calgary from the U.S. Took part in the rapid test program at the airport and left isolation after receiving an initial negative test result. Since she left isolation, no less than 8 people in her network became infected in a matter of days. When the woman was tested a second time, the result was indeterminate. How confident are you in the airport rapid testing program, and do you believe people returning from abroad should continue to isolate until receiving a second result?
Thank you for sharing that information. I'm not aware of that particular case. What I know is that the test that's being done for the border pilot is a test that has Health Canada approval, that it is as sensitive and specific as the tests that are being done in the Alberta Provincial Laboratory. So that's certainly a concerning story that you're reporting, but again, I haven't heard the details of that, so I'll have to go back and check that with the team because the test performance, as I've said, has been checked and has been found to be as accurate as the other tests that we are doing.
Operator, could you put through the next caller, please?
Next is Michelle Belfontaine with CBC. Go ahead, Michelle.
Oh, hi there. This is a question for Dr. Hinshaw. Dr. Hinshaw, a source close to you told CBC that you referred to your relationship with the provincial cabinet as an uphill battle. So what can you tell us about that?
You know, my dad used to say that if you and your partner always agree, then one of you is unnecessary. And I think that same concept could apply to very difficult decisions that have a significant impact on the whole population, which is that it is critical that multiple perspectives are heard. And while the recordings that were referenced in some of the news stories today indicate that at times I have felt frustrated, as I am a human being, the reality is that it is critical to have multiple perspectives and that those perspectives are all heard, and that in that conversation that those elected leaders know my perspective and then take that into account and make the final decision as the representatives of the province, which is their role.
All right, we've got time for 3 more questions. Operator, could you put through the next one, please?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi there. This is a question for both the Minister and Dr. Hinshaw. Why can't the public see the recommendations from the Chief Medical Officer? Would it not help the public understand the ultimate decisions and add a layer of transparency if the public could see the information that was underlying those decisions?
The recommendations that I make are a part of a process, which is that the individuals who are employed by the public service, and I am one of them, provide our best recommendations to those elected officials who then make the ultimate decision. And the process by which that goes forward is protected by the legislation that talks about the ability to provide that advice in confidence. And so we follow our oath again as those people who are in the public service, and we follow that process. And again, I'm very disappointed that someone has violated that oath today. But at the same time, the vast majority of my team follow that code and respect it. And I'll turn it over to Minister.
Thanks, James. Yeah, it's a simple answer that I cannot and will not be breaching cabinet confidences. I've taken an oath, and I will not be breaching that oath. Thank you.
Operator, could you put through the next question, please?
This is Lisa Johnson with the Edmonton Journal. Go ahead, Lisa.
Hi, thanks for taking my question. I'm wondering for Dr. Hinshaw, do you know who made the recordings and will there be professional repercussions?
I do not know who made the recordings and who spoke to CBC. There will be an investigation to determine who has done this because, as I said, this has serious repercussions and is a violation of the oath that all of us have taken.
All right, operator, could you put through the final question, please?
The final question is Rafi Vuchakanian with CBC. Go ahead, Rafi.
Dr. Hinshaw, you referred a lot to trust being broken today, and you also explained why you're not providing the recommendations. But why do you not have the same level of care over the trust Albertans may or may not have in you, as you repeatedly refuse to tell the public what your recommendations to this government are and whether they're all being followed?
My professional integrity is incredibly important to me, and when I've taken an oath that indicates that I will provide the recommendations to elected officials in confidence, it would be inappropriate for me and a violation of my professional integrity to break that. I believe that Albertans understand that I provide those recommendations in their best interest. And again, it is the individuals that Albertans have elected, trusting them with the responsibility of making those weighty decisions on their behalf. And so Albertans have placed their trust in those officials to take my recommendations along with all other considerations and to make the best decisions possible.
And the minister has a supplement to that answer?
Thanks, Rafi. I think the difficulty with the premise behind the question is that a lot of these media stories, and as we've seen over the past few weeks, what I see as attacks on the credibility and the independence of the office of Dr. Hinshaw and herself and the ministry end up, to some extent, undermining as well the confidence that people have in the measures that we've announced, including the ones this week. The difficulty with that is that results in people not giving credence or deference to those measures, and which means there's an opportunity for people to continue to spread the virus throughout our community. So it is, unfortunately, incredibly irresponsible to see these types of attacks on this credibility and the independence of Dr. Hinshaw and her office. And I hope that those who are perpetuating it realize what's going to end up resulting with these types of stories, and that this ends. Thank you. Thank you, Tom.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Thank you.